Good morning. It's Thursday, March 18th, and you are with us at The Doctor is In. Ask Dr. Harwoody. I'm Sybil Madison, your Deputy Mayor for Education and Human Services. I'm so happy to be here with Dr. Allison Harwoody.
Morning.
She is your Commissioner for the Chicago Department of Public Health. This is where you can get your questions answered and accurate, good information about COVID in Chicago and, of course, about the vaccine. We're happy to answer your questions. You can put them in the chat box below. You can also use the hashtag AskDrHarwoody through Facebook or Twitter. As usual, we're going to check our distance.
Good.
Not a thing of the past. Not for long. How about the latest data?
All right, so let's take a look. Chicago.gov/coronavirus. That's always your one-stop shop for anything related to COVID in Chicago. You can get to the vaccine information from there. You can also get to the vaccine information directly, chi.gov/COVIDvax, and you can get to the dashboard directly, chi.gov/COVID-. So if we look at the dashboard, you will see that things remain stable, but we have stopped seeing improvement. Really, if you look, our positivity is sitting at 2.9%. A week ago, it was 2.8%. It's really been sitting just under 3% here now for a few weeks.
What do you think that's related to?
So I think it's related to a few things. One is that, our testing numbers remain very good. We're doing about 11,800 tests per day. That has also been stable through this time. And so, I am glad that people continue, if you have symptoms of COVID, you need to get tested. You need to stay home, right? Like none of this has stopped. And it's important that we don't forget about testing in this. And I think that has managed to stay reasonably high. As a reminder, positivity is positive tests divided by number of tests done. And so if our testing falls off too much, that is another thing that can actually make positivity go up. And we keep sending, we look at the data every single day, and then each week we are sending our mobile testing efforts to the parts of the city where we are seeing any surge in cases, where we have any concerns. We continue to do that. We've been doing it throughout, and we do continue to detect COVID when we are out doing these mobile testing. So one is that I think, our testing has been stable, which is good. Our cases, if you look though, are up a little bit too, right? Yeah. 295 a day. A week ago, we were at 271. So it's up 9% from a week ago. And it is good that we're under 300, but I'm not thrilled about this, right? We got to get under 200 cases, even to come out of moderate risk, getting down to even that sort of lower risk, which is a long way from low or controlled. We had some very, very nice decline, and then we stalled out here, sort of just under 300. And so that slight bump in positivity you're seeing, it's not a change in testing. It actually is an increase in the number of positive tests. So this is not a cause for major alarm at this point, but it is a reminder, I hope, for everybody that we are not actually at a low risk setting from COVID here in Chicago. And although we're making beautiful progress on vaccination, we said, if people saw at the press conference yesterday, 1 in 5 Chicagoans has now gotten at least a first dose of vaccine. 1 in 4 Chicagoans, if we limit it to people who are over the age of 18, which is basically who's eligible, and just about half of our seniors. However, what does it mean to be fully vaccinated? Do you remember?
You have to have had your second shot in 2 weeks.
Perfect. Exactly. Exactly. Putting you on the spot, but you knew.
Teacher.
But you knew. And that's right. So, number one, you're only considered fully vaccinated 2 weeks post your second vaccine if you got Pfizer or Moderna, and 2 weeks past the single vaccine if you got J&J. But the great majority of people here in Chicago at this point have gotten Pfizer or Moderna. J&J is just starting to come in, and we can talk about that if people have questions. So 2 weeks post that is when you are considered to have protection. And where we talk about who's gotten 2 doses of vaccine, it's like 1 in 10 people, right? It is more than a quarter of the folks over 65. And again, we're making good progress here, but we are not at a point where most of Chicago has been vaccinated. And we are definitely not at a point where COVID has gone away. And
it's interesting because perhaps psychologically,
right.
With vaccine being here.
Yeah.
And coming out of that surge,
Yes.
right? Where
Yes.
it feels like things
Yes.
are so much
things
more
are
under
so
control.
much better. Things are so much better. And right, it's this moment right now where we're feeling good, right? Spring is coming and we're getting a lot of people vaccinated, and that vaccine rollout effort is going well, and it's getting to the places where it needs to get. And the case numbers that we're seeing, we're not seeing those racial and ethnic inequities that we were seeing for so long. We're averaging just 3 deaths per day, which, okay, 3 deaths per day is too many deaths. Like, don't get me wrong on that. But where you think about at the peak of the first surge, we were having 50 deaths a day here on average here in Chicago from COVID. Peak of that second surge in November, about 25 deaths per day, every day on average here in Chicago. So to be back down in that 3 deaths per day range, that's where we were over the summer, is good. And the hospitalizations have been good, and we're making progress. But my worry is we are seeing COVID all over the city still, to be very clear. We were looking at kind of, in the last month, where were we seeing every zip code, right? Like where we looked in the month of February, for example. Every zip code not only had cases, but every zip code had people hospitalized with COVID. And we are seeing, some more surging in parts of the city that we have not always seen as many COVID cases in. And so, I just want to reiterate that although the overall good news, the overall news definitely is good, and the variants, right? They're here, right? We were detecting them. And when you wear your mask, where you social distance, where you continue to avoid the crowd, stay home if you're sick, all the things we've been saying so far, like, those things also protect you and Chicago from the variants. And so vaccine is a piece of this, but we're not at a point to be like, yay, vaccine, no more COVID.
And not out of the woods.
We're not. And as every week goes by and we can see these numbers be relatively stable, I'm reassured, but I worry. I was reading an article that said, I think the last 5 days of air travel have been the most air travel that we have seen in the U.S. since COVID started. Not the time over Thanksgiving, not the time over Christmas, these last days, because people are feeling safer. And certainly people who are fully vaccinated are safer, no doubt about it, right? And this is sort of this thing. Like, it's so exciting where people are fully vaccinated that it is safe for people to gather, right? If everybody is fully vaccinated,
2 weeks post
2 weeks post second shot, and you are in a small group, like in your household, you can gather without a mask, right? Like, that's amazing and that's exciting, but that does not mean you can go to a party. That does not mean that we're open to the whole world, and it does not mean that, especially if there are people who are at higher risk, like, even if you're vaccinated, like, we're not done.
That's interesting. It makes me think about how we used to talk about gatherings and how likely it would be that X number of people in a group of 10 would have COVID. Now it's kind of the flip, right? Like, we're still at a point where if there are 10 Chicagoans together, only one, right,
is vaccinated.
Is fully vaccinated.
That's right. So, and even they're not all 2 weeks post, but that's right. Yeah, that's right. It's sort of, I think there's more of a sense as people are starting to get vaccinated that it is generally sort of good in the world. And I think, the thing is, at 300 cases per day, there's still a pretty good chance that in a gathering size, even of 50 people, we could pull those numbers out if folks are interested the next time. If you assume that the cases are distributed across the city, et cetera, we know that there are plenty of people who have very mild symptoms or are asymptomatic, and there is still, at 300 cases per day, the larger the gathering size, there's still a very good chance that somebody in that gathering has COVID, even if they don't know it. So the reason we want that number down is because it's what actually lets us gather in larger groups without this risk for COVID. And as more people are vaccinated, the risk, even if somebody does have COVID in a group, goes down. But where we are now, still, those groups in general, there's a lot of COVID still, unfortunately. So we got to get this down. We're doing a good job, really, I think, by and large. We're seeing people wearing masks, really pleased. Overall, the St. Patrick's Day celebration, seeing that the bars and the restaurants almost universally we're sticking to those precautions, we will be opening up,
Yeah.
keep going as long as things stay stable.
But like to what we want.
Yeah, and we are close. We want this summer to be good. We want this summer to be able to be certainly so much more open than we were, but kind of in the same way, when we were talking about the 1C, which people probably have questions about, I was really emphasizing that most people in Chicago are going to be eligible at this point, adults, and be able to get a vaccine probably in April or May. That's exciting. But getting that vaccine in April or May, we got to kind of get through April and May, right? It's like this mix. It's not that much longer, and we are opening things up as we can. But please just stick with what's gotten us this far and watch that number. That 295 number, we don't like it. Under 200, and ideally even lower.
Yeah. Okay. Ready for questions?
Ready for questions.
All right. April Rodriguez from Facebook. When will personal care providers be eligible? I am a massage therapist and I am in a closed room for an hour at a time.
Yes. All right, April. Good news for you.
And not working from.
Yeah, exactly. Yes. So good news for you. We announced yesterday that, as expected, and as we've been hinting at all along here, on March 29th, so about a week and a half from now, you will be eligible for vaccination because. What is phase 1C? 1C is people who have underlying conditions, and on the website, chai.gov/COVIDvax, you can find the list and the details of those underlying conditions. If people have questions, we can pull it up and show you where that is. And it opens to the other essential workers. So you'll remember that in phase 1B, who are we doing in phase 1B? People who were 65 and older, and then the frontline essential workers really at the highest risk of COVID exposure, where we had seen a lot of cases, or who were in the essential roles like education that were prioritized. And we've been doing a bang-up job getting these folks done. A lot of essential workers have been vaccinated in 1B, and we've gotten through those groups. We're doing CTA right now. We're doing a lot of manufacturing right now. We're nearly through the educators, and not just the CPS, not just the big systems, but the small ones. We've been doing the daycares. We've been doing the child cares.
The family home-based care.
The family home-based cares. We did the first responders. We did the correctional officers. We got vaccine into the settings that are highest risk, the congregate settings, our long-term cares, our shelters, into the jail setting where we were seeing a lot of surging cases. And so we have made really good progress, and we anticipate that really by March 29th, we will have gotten enough vaccine to get through about, 3/4 or so of the folks who are eligible there. And certainly we've not had any problem with any vaccine going to waste or any problem filling appointments. And so we will be moving to make both folks with those underlying conditions and the frontline essential workers who were not previously included in 1B. So. And I'm guessing there's going to be other questions about this, so maybe I'll just go ahead and start there. Some of the questions are, shouldn't we just do the people with the underlying conditions first, right? And right now, we have said to healthcare providers that if there are unused appointments, that you don't have people who are over 65, right? They're people who are eligible in 1B. You can and should be vaccinating your highest risk patients with underlying conditions, right? Like if you think about a pod or a mass vac site, that is not the setting where we can really prioritize across conditions. We're not asking people to bring in your prescriptions or your doctor's note, but in providers, they know who's sickest. And I want to make sure that, people who are taking care of patients with cancer and people who are taking care of patients with underlying, serious diseases that put them at risk have the ability to access vaccine, ideally earlier. And
this is how it happened initially with our 65 plus.
Yes,
right?
Same way. Yep.
Providers reached out to their patients, and of course they knew that they were over 65.
Right.
And so a lot of people were just getting a call.
That's right.
Or getting a note that's letting them know that they can make an appointment.
That's right. And so we'll be, we have already asked providers to start doing that. Reminder, we're at less than 50% of our people over 65 vaccinated. And again, the major focus is getting these folks in right now, because as of the 29th, when we open up to essential workers and people, like the questioner who cannot keep distance at work, right? For so many of these folks, their job requires them to not be able to keep the distance, and they're seeing a lot of people potentially through the day, and where we think about wanting to keep that risk down. Really, CDC recommends you do a mix of people who are at highest risk for severe outcomes and people who are at highest risk for basically spreading disease and are kind of in roles, especially work roles, that they can't keep separate. And so we did want to make sure that vaccine was open to people who are working in your restaurants, right, and delivering your packages, and especially where we think about people who may be in some of those lower wage essential worker roles, people who are doing your nails, people who are doing your hair. Like, these are not people who can keep distance from COVID at work. And so opening up that availability broadly, we do think is absolutely the right thing to do. So as of the 29th, you would be eligible. Like I said yesterday, there is not going to be enough vaccine for everybody who is eligible, for the great majority of people who become eligible. But we are hearing very, very good news from the federal government related to increasing in vaccine. You look at how much vaccine we had in 1A as compared to 1B, we've got about twice as much, a little more than twice as much. So, it's ramped up very quickly. You go from 1B into 1C, we anticipate that going up twice as much again. And President Biden has said they expect all Americans to be able to be eligible by May 1st, right? And so this move kind of at the end of March is opening this up very broadly. But it means, for the questioner, my guess is you will be able to be vaccinated sometime in April or in May. And there will be, at City of Chicago, points of dispensing or mass vaccination sites. You'll be able to check off your kind of work. You'll be eligible for an appointment as more and more appointments come available as more vaccine gets here. So we've got all the capacity to grow and grow and grow like so fast. I've got 600 providers, plans for mass vaccination sites. Like, we can handle so much vaccine here. And as more of it comes in, you'll be able to get an appointment. So I hope that makes you happy.
All right. I hope so too.
Yeah.
Eileen Sutz from Facebook. What about homebound people that qualify? Turnaround time is very, very long.
Yeah.
Most I know have heard nothing back.
That's right. So really good question, and thank you for that. So there is, we have launched a homebound program here for people who truly cannot leave home, right? They are so ill or their disability that they don't leave home. They don't leave home to go to the doctor's office. They don't leave home. We want to make sure those folks are getting vaccinated. And but this is really the most time-intensive way to vaccinate people. And if they truly don't leave home, their risk is only from people who come into the home, right? And so, making sure that those folks can get vaccinated is really part of the plan in a lot of ways. And so, yes, you're right. We've had more than 3,000 people sign up that they would that they need to be vaccinated through the homebound program. But I want to help folks understand. We've got Chicago Fire Department, for example, right now, who are going out, who are doing this. But what does it mean to do a homebound vaccination? It means that you are driving to somebody's house, you are doing the pre-work that has to happen. You're vaccinating the person who is homebound. We're also vaccinating anybody else who lives in that home, so we get them done. You are monitoring them for at least 15, and in many cases 30 minutes. All the people who you vaccinated, you're getting their paperwork done, you're turning in their stuff. This is like, an hour probably by the time you're counting the driving, even in a very efficient system. And so even a very efficient CFD team, if they're working an 8-hour day, maybe they're going to do like 7, 8, 10 people in a day. And so we will be committed to getting this population done, but we are going to be vaccinating homebound people. My expectation is well into the fall, realistically. And as we get through more of the mass vaccination sites, you think about the difference between, United Center, you're doing 5,700 a day, all kind of in one day there. And it's not that we're not committed to this group, we are, but it is going to take months to get this group fully vaccinated. And I think we'll be able, as more of the population is done, we'll probably be able to shift some additional resources to this. We're very committed to it, but just as a reminder, if people do have another opportunity to get vaccinated, the faster way to get vaccinated is not going to be through the homebound program, just from a resource perspective, and really encouraging their caregivers to make sure that they're getting vaccinated sort of in 1C is going to be a quick way to help protect homebound folks as well. So more to come about that. And again, we're going to be doing some more planning where there are other kind of into-home events that are coming. But I just want to set an expectation that it's going to be months probably before all of the people in the homebound program are able to be vaccinated.
Yeah. Andy B. from Facebook, I saw on the news that the governor will open up vaccination on April 12th. Is Chicago going to expand vaccination eligibility on April 12th?
Okay, so I am not sure, I know the governor is making some formal announcements. What I can say is that if there's a plan to expand broadly, sort of what does that mean? I think it would mean right now there has been, most of the state has been in a 1B plus, right? In this, well, I shouldn't say most of the state. Some of the state has been in 1B plus, where if there were counties that were able to get through, there are people who were over 65, they have then been moving ahead to bring in folks with underlying conditions. So just like here in Chicago, we've said if there are people who if you can't fill appointments with people who are over 65, through providers, through the United Center, et cetera, we have been vaccinating people with underlying conditions. That is where a lot of the state has been. And my assumption is that really with President Biden's ask to make sure that everybody is eligible for May 1st, that there's probably going to be an ask at the state to basically just go ahead and open to everybody without any prioritization for the other essential workers. And I think, I want to see what the official kind of announcements, et cetera, are. But the great, where you look at everybody who is an essential worker, where you look at everybody who has underlying conditions and everybody who is already in 1A and 1B, we are talking about most adult Chicagoans. Mm-hmm. And I do actually, I would like to spend the first month of this 1C period vaccinating, still doing some prioritization so that people who are giving massages and people with underlying conditions are prioritized above, healthy 23-year-old college students, Yeah. And we absolutely, assuming that the vaccine supply is there, we will for sure expand to everybody May 1st. Maybe we'll do it before that if it's there. But as opposed to sort of splitting the difference in terms of weeks, right? Some of it's just about how much do you have vaccine supply and when. Yeah. Just about everybody who needs to get a vaccine, like in a prioritized way, is eligible, honestly, from March 29th here. And over the month of kind of April and by May 1st at the latest, assuming the vaccine supply is there, we will also be open to absolutely everybody.
Okay. Ju Sten from Facebook, what is the spoilage count on vaccines disposed of due to non-use to date?
Oh. Approximately zero. There was, yeah. So let's talk a little bit about that spoilage and wastage, because we continue to get, I think people maybe don't fully understand sort of what happens related to vaccines. So let me back up a second and kind of talk through. So the way vaccine comes to us. If it is Pfizer vaccine, it comes and it is in this ultra cold state that needs to be kept ultra cold. And Moderna comes to us frozen, and J&J comes to us refrigerated. Even the J&J and the Moderna vaccine can sit for 6 months in the ultra cold or the frozen state. No problem. It can sit for 6 months if it has to. From the time that you pull it out of the ultra cold or the frozen state, the Pfizer vaccine, you have 5 days to use it from when you pull it out and you have it in the refrigerator. And so we plan, with the hospitals, at all of our pods, to make sure that all of that vaccine is used within 5 days. But we don't have any problem with doing that, right? Because if for some reason you're a little, say you have 1,000 appointments booked at a site for a day, and 960 people show up, those next 40 doses, you use them the next day. Mm-hmm. And you're within the 5 days and it's not a problem. So we don't have any wastage there. And actually with Moderna, once you pull it out of the freezer, you have 30 days to use it. So one of the reasons we like it in the outpatient settings is the same kind of thing. Say a provider was planning to do 25 vaccinations sort of in a given day, and they pulled this out, or, I mean, we should round it off, but you get the idea. They can hold that in the refrigerator for the next day, for the next day, for the next day, for the next day, for 30 days, no problem, as long as they haven't opened the vial. It's when you puncture the vial that you have hours to use vaccine in. Because the Pfizer vaccine has 6 doses in a vial, and the Moderna vaccine has 10 doses in a vial. And so where we're talking about this concern for wastage or throwing vaccine away, which we do not do, we are literally talking about like 5 doses when we're talking about Pfizer. So at the at the United Center, 5,700 appointments getting done with Pfizer. We draw up this vaccine, and at the end of the day, you're talking about like 5 people, right? 9 people. Like it's a very small number. And we do have a plan, like at the United Center, there are a lot of staff on site who still need to get vaccinated, and we prioritize their vaccination. But this idea that somehow there are like hundreds and thousands of vaccines that are being wasted, that are being thrown away, it is not happening. It is not happening in Chicago. It is not happening anywhere. We had one situation here where there was a provider that had a freezer failure, and they had something like 150 vaccines. I mean, we don't like to see any vaccine go to waste, but it had the freezer had fallen out of the time, and checked with the company, and they said just sort of, we want people to report that if there are ever problems in the cold chain. But literally, like, that's it. Like, there has not been wastage of vaccine, and you can tell I'm a little bit, because it's the thing that people keep using as an excuse. People keep saying, like, if I weren't here to get this vaccine, it would be wasted, right? Even if maybe I wasn't eligible, or I've just driven from like the far suburbs to areas of Chicago that really need vaccine, there's this sense that like it's going to be wasted if I'm not there, and I cannot tell you strongly enough, it is not going to be wasted. And there are plans in place, and at none of our sites are we wasting vaccine. And the amount that you would even waste, it's like these teeny numbers really at the end of the day. So I hope that helps clarify some of this. I think, there were these stories in the news about the, people marching through the snow and like giving out their last vaccines. People love those stories, but I think they don't understand those stories are like 5 people, right? They're not like hundreds of vaccines. And the few times where you've seen this, like, oh, there's a lot of vaccine that has to go, it's because like a freezer failed or something, and they've been trying to figure it out. So,
Scarcity breeds all
kinds of... You're right. Scarcity breeds rumors.
Notions. Yes. Okay. John Special from Facebook, that name sounds familiar. Why is Chicago considered separate from Illinois vaccine allotments? And if we're not getting enough vaccine to meet demand, then why does the state keep opening vaccines up to younger age groups?
So Chicago gets vaccine allotted directly because we are a large population city. And not just COVID vaccine, but like all vaccines come directly to Chicago sort of as a large city. New York is the same. There are other large cities that directly get vaccine allocations. And some of this has to do with the way CDC funding is set up. It has to do with allocations, et cetera. But it's built on the back of how the regular immunization programs are done. We have a very, very strong immunization program here in Chicago. We're really known for it. And so the goal of the CDC, which I think is a good goal, is to make sure that you are using existing structures that are in place to really distribute vaccine well. And one of the reasons why we have hundreds of vaccine providers enrolled and no problems in terms of sort of efficiency, all this, is that we are built on the back of a really, really excellent childhood immunization program that CDPH runs. And
so the footprint that we have of providers was already there.
The footprint was already there. Right. I mean, we've pulled in new ones, a lot of new ones. And we've done outreach, especially to parts of Chicago that don't have as many healthcare providers. But the backbone of this were our regular, what are called vaccines for children providers that we interact with all the time. Like, we check their freezers, we do the reporting, we have report cards, we like like it's this infrastructure that is very strong and in place, and it's the main infrastructure that we'll be dependent on, especially after this immediate surge. People will get vaccine through, their healthcare provider, through their pharmacy, just like you normally get a flu shot. We're not that far from it, from being at a point, I think, by probably June, you're going to be able to get a flu shot. You're going to be able to get a COVID shot in the same way that you can get a flu shot during flu season. It's not a can I find one? It's a let me go ahead and get one. And the providers will be really the backbone of that. So that's why it has to do with some of that backdrop. But I do, and we have been pushing and having conversations with the state about making sure that parts of the state that are not as far along in terms of getting the population vaccinated, get additional vaccine. Just like we do here in the city, we look and say, where are we under vaccinated in Chicago? And we prioritize some of those zip codes for appointments at the United Center or for issues. Really at the state level, one of the issues has been that a lot of, Chicago's vaccine has been being used to vaccinate people who live in suburban Cook, for example. It's fine, right? Like where people are essential workers, we want to get them vaccinated. We are in no way we are all one ecosystem. We want people vaccinated, but where there has not been as much vaccine to some of the areas around Chicago, it's part of where we are, because we're super efficient, right? We're getting all the vaccine we get into arms, 95% of it, or even more, within 7 days after delivery. So it's just been an issue of vaccine supply. I'm really happy that more is coming, and my hope is that even more will come to the suburban areas around us too, to make sure that Northeast Chicago is as vaccinated as some other Northeast Illinois is as vaccinated as some other parts of Illinois.
Okay. Christina Judge from Facebook. And this is, I guess, related to the wastage question.
Okay.
But wouldn't it be wasted if the staff wasn't there to take the leftover doses? And 5 doses per day per site adds up.
Yeah, I love it. Yeah, good. You should come work on my logistics team. This is exactly how we think. Yes, if you did not have a plan to use your doses at the end of the day, there would be the potential for wasting those 5 doses of vaccine. But the point is, you have to have a plan for what to do with those doses. And we've really pushed providers hard that they need to have a plan, right? Once we are through our staff, there is a list of other people who live nearby and have noted, and would be eligible, who have said they could be there on short notice to get vaccinated, for example. We have worked very hard. Even the homebound program we've thought about as being a good example of where you've got 5 doses at the end of the day. Those would be good doses to perhaps push to the homebound program, right? Yeah. We're just not wasting vaccine. Everybody has to report. There's a ton of reporting around vaccine. People have to report, if I got 100 doses of vaccine, I have to report, how many doses did I use? You have to report how many doses did you waste. That is a reportable thing if you waste a vaccine. Even one vaccine, which is how we know that there's basically no vaccine being wasted. So, good question, but it is a best practice and one that we really have pushed hard here in Chicago to make sure that people are drawing things up in a way that doesn't leave them with a lot of drawn up vaccine at the end of the day, and that they have a plan.
Well, Christina says she would love to work on the logistics team.
We're hiring.
Okay. Sheila Giangreco from Facebook. Why are fully vaccinated people only allowed to gather in small groups with other fully vaccinated people? If you're protected, wouldn't you be able to gather in a large group because you would be protected whether it's a large group or small?
Yeah.
My understanding is that only unvaccinated people would be at risk.
All right, so let's talk a little bit more about this.
Gotta unpack this.
Gotta unpack this a little bit. So the specific CDC guidance says, you can gather in, let's take even one further step back. So these are fantastic vaccines, right? I could not be more thrilled with these vaccines. Moderna and Pfizer, 95% protective. Now, this was done before some of the variants were circulating, but nevertheless, fantastically protective. Every vaccine is almost 100% protective against hospitalization, against death, the stuff we really, really care about. But as we start to get into the sort of more mild or asymptomatic COVID, there are still some questions that we are learning about. And even a vaccine that is 95% protective, that means there's a 1 in 20 chance that if you get exposed to COVID, you could get COVID, right? Mm-hmm. And so there isn't a vaccine better than that, really. I mean, it couldn't be better, but it's not 100% protective. So that's one. Number two is that we are still learning. We know when somebody gets seriously ill with COVID, like sick enough to have to go to the hospital, or people who die, COVID really gets in. It's in their lungs. It's like majorly making them sick. However, people can have COVID, and this has been one of the challenges of COVID, it never really gets into their lungs. It's just in their nose, right? Mm-hmm. But you can sneeze and you can cough and you can talk and you can spread it without it making you sick. This has been like the sneak trick of COVID of all things. It is what has made it such a successful disease, is that it is able to spread very nicely in people who are asymptomatic or pre-symptomatic. They don't develop vaccine. It's why we had to switch to wearing masks when we realized how much spread was possible before people are symptomatic. And so when people have been vaccinated, first of all, their own personal protection against severe COVID is fantastic. Even their protection against mild COVID is very, very good. But there still are some outstanding questions that people probably can carry some of this COVID, and if they're exposed, especially to somebody who isn't vaccinated and has a higher risk for COVID, when we still have this much COVID around, it is not a completely no risk situation. And so, as the specific CDC guidance said, when everybody is vaccinated, yes, you can gather and you can come together and that's fine. But what it also said that if there are people who are unvaccinated, that was like the other thing. Because the big question is, I'm a grandparent. I want to see my grandkids. I haven't seen my grandkids in 6 months. My grandkids can't get vaccinated yet. Can I see my grandkids? Yeah. And we said, yes, you can see your grandkids. If you've been fully vaccinated, you can be in one other household with people who are not vaccinated, as long as nobody in that household is at risk for severe outcomes of COVID. Because the risk is lower, but it is not zero. And as more and more and more people get vaccinated, as that 295 number gets down under 200, hopefully under 100, the risk just it drops lower and lower and lower. And so, congratulations if you are fully vaccinated and protected. That is 1 in 10 Chicagoans at this point. And we need people in public, especially, even if you're vaccinated, keep wearing the mask, keep doing the distancing, and as more folks are vaccinated and the risk gets lower and lower and lower, we'll start being able to ease up on some of that. But you got this far, right? Come on, you got this far. You could do it a little bit longer here. One of the big things about COVID is you wearing your mask protects others, right? And so asking people, please, for a little longer here, to keep doing those things that have gotten us this far as we get more folks vaccinated, particularly with the variants.
All right. Patty Zerbel from Facebook. Why are there no J&J vaccines available? When will we get them here?
Okay. So let's talk J&J. So we are so excited about J&J, right? Yeah. Like the ability to do one vaccine and done with really, really good, fully protective in the trials against those severe outcomes, just huge. So we got a nice big bolus of about 23,000 J&J vaccines, almost 3 weeks ago now.
Yeah.
And we started using them right away. We started using them in the homebound program. We started using them out at O'Hare, where we've got, essential workers, airport workers, et cetera, in 1B. We've been using them in some of the high-risk manufacturing settings. You're going into a factory, places we've seen outbreaks. Get everybody done, especially for strike teams, right? This is really good to not need to have an entire kind of second round in terms of getting those folks done. And I think especially where we're talking about workers who are generally healthier, this is win-win all the way around. Here's the thing. The FDA is still has been evaluating the mass production sites for J&J. So when a vaccine first gets that emergency use authorization, there's a certain amount of vaccine that's been made and is kind of ready to go, right? And so right away they pushed out what they had. For us here, that 23,000 doses, but part of the FDA process that people don't pay that much attention to is they are also going, and trust me, we want them to do this, looking at like all the places that are making millions of doses of vaccine and making sure that all of the production capabilities are perfect, right? That we're not contaminating vaccine by accident, that like all the ways that this is being made en masse are good. And you might have heard, there's been some really creative things here. They're bringing in other production facilities. The federal government worked out a deal where Merck, which is normally a competitor with J&J, Merck is going to be helping to make J&J vaccine because they have the facilities and they have the capability to do it. And J&J in a lot of ways is a more traditional vaccine, the refrigerator, the way it's made. And so we actually have more production capacity in a lot of ways for that kind of vaccine than we do for the mRNA ones, which this ultra cold, they're more sensitive, they're harder to make. And so I expect the FDA, today or tomorrow, hopefully will give the blessing to some of these large vaccination production facilities that have been producing vaccine. Don't get me wrong. It's not that they haven't been producing it, but they haven't, you can't just send vaccine out from a factory until it's had the FDA stamp of approval. It's a safety check. We want this safety check, right? Safety, safety, safety comes first for everything related to vaccines, everything. So I expect that will probably come through. We're hearing, I've been paying a lot of attention to this at the federal level, probably sort of today or tomorrow, and then we would see hopefully quite a bit more J&J vaccine starting to flow as soon as next week and the week after. And the production capacity for this, we do anticipate increasing a lot in April and then again in May. And so, right now, we did get sort of almost a little surprise. We got like 2,000 doses that we weren't necessarily expecting, which is great. Like every time vaccine comes in, we use it. Like we use it. I hope people are understanding this. But I want to get to a point where we're getting 20,000, 30,000, 40,000, even more a week. And we'll be able to, yes, keep using them in these strike teams, but yeah, I think we'll be at a point where we'll hopefully have some of the mass vaccination sites that will have J&J available, for example, and it will be more in the community. So I know people are excited, some of you, about getting J&J, and I do think there will be opportunities for that to happen as supply ramps up again in April and May. Pfizer and Moderna are not going anywhere. They're great vaccines, and we're going to keep using them, but I think J&J is where we're going to see more growth, probably over the short term here. And then don't forget, there's at least 2 other vaccines kind of in the wings here. AstraZeneca and Novavax are both, I think, kind of in that April-May timeframe also.
Are they one shot?
They're 2 shots. They're 2 shots, yeah. So
interesting with the J&J, it's half the time to get fully vaccinated,
correct.
Right? So you imagine the impact that you could have with a lot of it.
Correct. So, more to come there, but we are really excited about being able to see this one ramp up. I mean, any vaccine is fantastic vaccine. Like, I just want vaccine.
Yeah.
But I do think there will be some more chances for the general public to be able to get that again as there's more. ZocDoc.com/vaccine is going to continue to be the place where you go to find vaccine appointments moving ahead, and providers are going to connect there. Our pods are going to connect there. The pharmacies I know are on their own platforms, but as they start to get different vaccine, and I know it's hard to imagine, but there are places that are telling us that like around the country and to some extent even downstate, there are places that are saying, like, I have vaccine, I am not at a point where it is so, like right now we put appointments up. There are a small number of appointments at least that go up on ZocDoc every single day, and they're gone like instantly, right? Yeah. And I know how anxious so many of you are to get vaccinated, and I'm glad about that. I just want to get you vaccine, but I don't think it's that long from now, right? Like I said earlier, that it will be more broadly available. Yeah. So more to come there, but I'm sorry. Hang in there. Hold on a little longer.
Okay, well, good news?
Oh, good news. We're there already.
Yeah, we're already there.
So I've got an unrelated COVID, but it was such a good piece of news that I thought it was good. So our very own Kennedy King College in Englewood was just ranked the 8th best community college in America. How about that? By Forbes. Really congrats to City Colleges of Chicago, students, faculty, and staff who made this possible. You know, we love Chicago community. We love them all the time, but we have also been partnering with them on a lot of the mass vaccination, the pods that the city has been running, and they've just been amazing partners in terms of being willing to open their space, in terms of helping with a lot of the kind of education and support for the community-based contact tracers that were hired. They really have been amazing partners in terms of helping get things done and thinking about how that sort of higher education can play a role. And anyway, so I just wanted to give that shout out because I thought it was exciting.
The City Colleges of Chicago is just a gym in the city.
Yeah.
I must also say, you know, spring semester is going to start soon, so enrollment will be coming up. This is a great option for those of you who have college students who want to do a 2+2 and save a little money, but it's also a great option for people who want to skill up, who want to pursue a new career. There's so much sector-based opportunities at city colleges, including the tech hub that's at Kennedy King. So glad that you mentioned that.
I know, that was a good one, right? And then I think my last good news, I'm just looking for the phone number, is that we have vaccine appointments available for seniors in Chicago at the United Center. Let me say that again. Any senior 65 older who lives anywhere in the city of Chicago, we want to get you vaccinated. If you know anybody 65 plus, please, they can call the call center, 312-746-4835. 312-746-4835. We've got 200 contact tracers who've been standing by, helping make calls. They're taking in they've gotten like 80,000 calls in. They've made like 18,000 appointments just in the last few days. The wait times are not bad right now. They've continued to staff that up, but like we gotta get our seniors vaccinated, guys. Like really, 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 really. And so if you know anybody and they're still hesitant, please give them a call. Please help them get an appointment. All the providers are continuing to focus on 65 pluses. The pharmacies are focusing on 65 plusers. And, you know, we've got vaccine appointments for people 65 plus who live in the city of Chicago. So call that number, call your provider, but don't wait because in just March 29th on, like we're excited because we're going to be able to open, but it becomes a lot harder for the people who were eligible previously if they didn't take that chance when they had it. So please, please, please. The good news is we continue to keep vaccine for these folks, and I want to make sure it's being used. There's going to be drive-through availability for seniors also, and there will be some more coming about that at the United Center. And we're not going to be done with seniors, but we got to get them done. Like we just, it's got to happen. So
yep. Get your elders vaccinated.
Yeah.
Okay, so I think that's it for us, Dr. Arwady. We'll be back. You'll be back on Tuesday.
Yep, we'll be back Tuesday at 11. And in the meantime, call anybody you know who's older. That's my main ask for you right now. And then just hang in there. Like the news is good and getting better every day related to vaccination. And if we keep that good vaccination news going while keeping the COVID numbers in good control, we're going to be in good shape.
I believe you.
I believe you. Yes. I believe you. Thanks. We'll see you on Tuesday.